everyone. Thanks so much for joining me. We're going to spend about 45 minutes talking about an introduction to nursing research. My name is Breanna Hetland. I'm an assistant professor at the University of Nebraska Medical Center, College of Nursing, and I'm also a critical care nurse scientist for Nebraska Medicine. So before we go into the details about nursing research, let's first talk about research. Research is a process that assesses or tests ideas, evidence, or questions to determine if outcomes are important or better than the current evidence-based practices that we use. Whereas nursing research is a systematic inquiry designed to develop knowledge about issues of importance to the nursing profession. Knowledge gained through quality nursing research is used to promote evidence-based nursing practices. So, why is nursing research important? First of all, it provides a scientific basis for nursing practice. So really, everything that we do as practicing nurses, whether it's at the bedside, a clinic, maybe a school, is essentially grounded in nursing research. Secondly, it brings improvements to nursing practice through the development of new techniques, tools, and new knowledge. So, a lot of times when nurses are out in practice at the bedside, for example, they might have a really great idea, something that they could do better, a new, more efficient way to do something or a new tool. With that idea, we have to test it. You can't just use something and say, oh, for that patient it worked. And so we use nursing research to systematically test it and then be able to come back and say, hey, we have the evidence to be able to make this part of practice. Nursing research provides solutions to problems concerning health. And I put a caveat here, it's health both for the patient and for a population. We can look at research studies that, might look at something very specific, or we can look at studies that look at, whole populations and policy change. So it really depends on the research question. Nursing research helps determine the areas of need in nursing. It enhances patient advocacy and facilitates changes in policy. And lastly, it advances the foundation of nursing science so that it can be used by other nurses. So let's talk a bit about who conducts nursing research and where. So this is somewhat of an ambiguous answer. There are lots of people conducting nursing research. By and large, it's conducted by nurses. But that being said, nursing is so transdisciplinary. The evidence that we come up with can be used by lots of other professions, and also the evidence that we might use, or some of the theories and some of the research that we do, might also be in partnership with other professions. So mostly nurses conduct nursing research. However, in particular, in like the PhD program I did, you didn't necessarily have to have a background in nursing to do a PhD in nursing research. So the answer isn't very specific, but the point is that nursing is extremely flexible, and we get lots and lots of smart minds from a lot of different professions that can contribute to nursing research. So let's talk a bit about where nursing research is conducted. Again, kind of an omnibus answer. Lots of nursing research is conducted in a hospital setting. However, there's a lot of nursing research conducted in a clinic setting, possibly in a school setting, many different communities, and in the lab. Nurses also participate in basic research, which we'll talk about a little bit later, where some things might be done in a lab, and then we talk about how we might use them in practice. And so really there's numerous places to conduct research, and it just really depends on what a researcher's expertise is and what the population is that they're interested in. So I just want to quick cover kind of what are the main foci or goals of nursing research specifically in 2020. Now, this is just a quick list that I put together. There are many more here, but this is where I really see nursing research as it is in 2020 focusing. So the first thing is outcomes research. Outcomes research is a branch of public health research which studies the end results or outcomes of the structure and processes of the healthcare system on the health and well-being of patients and populations. So we're really looking at, the kind of end goals of interventions that we are putting forth. The second category is biophysiological research. So nurse researchers have begun to increasingly study biologic and physiologic phenomena as part of an effort to better kind of develop their clinical evidence. And so I mentioned this previously, but nurses are kind of starting to put their feet in different doors. So they might start and work one-on-one with bench scientists and really get a better understanding of the biological mechanisms of a symptom, for example. And so they'll study the biological mechanisms of a symptom, then they'll go in and look at a patient population and how that patient's experiencing that symptom, and also how that symptom is being operationalized in that person's life. And so it's really kind of this blend of both biologic and behavior. The promotion of evidence-based practice. So the National Council of State Boards of Nursing explains that evidence-based practice is the integration of the best research with clinical expertise and patient values. As of late, there's really been a focus on getting nursing research to practice much quicker than we traditionally have before. And going forward, it's a whole subset of nursing research called implementation science that's really gaining speed. Number 4 is the predication studies to increase the rigor of evidence. So, practicing nurses cannot be expected to change a procedure or adopt an innovation on the basis of a single isolated study. So, where we're really trying to make an impact is conducting these larger confirmation studies with, different populations in different clinical settings at different times to ensure that the findings from the smaller studies are in fact robust and generalizable to other populations. There's really a focus in nursing on multidisciplinary collaboration. So, obviously, there's a lot of efforts within nursing for nurses to have interdisciplinary collaboration among themselves. So, for example, I am an ICU researcher. I research things in critical care. I might work with a nurse who studies things such as hospital transitions and the impact on public health. And we'll kind of combine our expertise to have an interdisciplinary collaboration. But beyond that, we want to also achieve multidisciplinary collaborations in which nurses are doing research in nursing, but combining their forces with other researchers in areas like genetics, genomics, medicine, pharmacy, the list could go on. So that's definitely becoming more of a rule, not a suggestion. We have to collaborate with people outside of the profession. 6 is to increase dissemination. The internet and other electronic communications have a huge impact on the dissemination of research information, which in turn may help to promote the translation of evidence into practice, thus helping those nurses who are working on the ground with the patients that we're obviously all trying to help. And lastly, there's a big push to increase the visibility of the profession. Most people, honestly, are unaware that nurses are scholars and researchers. A lot of times when I'm out and about, someone will ask me what I do for a living. And I'll say, well, I do research and I'm a nurse. So, like, well, you're a nurse or you're a doctor? Well, both. I'm a nurse at heart and I have an advanced degree in research practice. And so, really, we're this charge of just trying to get knowledge out to the public and to other professions that nurse researchers are, in fact, scholars and leaders amongst the scientific community. So let's quick transition into a very brief overview of the types of nursing research that are out there. Now, I'm only going to give you kind of the 4 main types that I see come across in the literature, but the caveat being that there are lots of types of research and subtypes within these main categories. So let's first quick talk about quantitative research. So the best way to remember the difference between quantitative research and qualitative research is that quantitative is about the numbers. Quantitative research is a means for testing objective theories by examining the relationship among variables. So there's several different subtypes. And again, I'm just providing a quick list as kind of a primer to what nursing research is. There's descriptive quantitative research. So this doesn't involve a treatment at all. It's not examining relationships. It aims to just describe the status of a variable. So let me give you an example of a descriptive study that I did. Recently, I had a research question and I wanted to understand what family caregivers of patients in the ICU wanted to participate in at the bedside. So traditionally, we'll have people come into the hospital and we'll let them come into the room, but we sort of sit them in the corner and say, okay, we'll ask you questions if we have them, but we just are going to take care of this patient and you can kind of sit over there as family. And what I wanted to know was, do families want to do more? And if so, what is that? Do they want to do oral care? Do they want to help turn the patient? So I went in and asked a series of descriptive questions to these people at the bedside just to get a better understanding of their experience as caregivers of a patient. Then we have correlational research. So again, no treatment involved here. The primary purpose is to examine a relationship. So cause and effect. So likely we will observe, we'll just come in and see things as they are and ask a couple questions and see if we can find any correlations between what we're observing. There's quasi-experimental studies. So in quasi-experimental, there is a treatment, but it's not always tightly controlled. So for example, we might not have a comparison group, or we might not have random assignment of an intervention. What that means is saying, randomly, you're the first person we enrolled, we're going to give you the intervention. You're the second person, we're going to draw a number out of a hat. You're also getting the intervention, but the third person randomly doesn't. Quasi-experimental studies might not have those types of extra features. And then lastly, there's experimental studies. So again, for 3 and 4 here, there are treatments. Experimental studies are the most tightly controlled by the researcher. We're trying to get random assignment. We're trying to have a control group, and we're really trying to take all of these variables and control as much as we can. So I have a couple examples here of different types of research that I've conducted. So I'm going to show you, this is a quantitative article, and I'm going to talk to you about qualitative research and show you a qualitative article that came out of the same study. So what we did for this study was developed a survey. It was a survey looking at what nurses wanted to endorse for family members to do at the bedside. So we went through and developed this survey asking nurses like, hey, what do you think about family engagement? And do you want people at the bedside? And what are things in your workflow that make that easy or hard? And so we asked them this survey. It was a quantitative survey. So they, were able to say on a scale of 1 to 5 if they strongly agreed or strongly disagreed. In addition to that, the last 5 questions of the survey were open-ended. And so we've asked things like, how do you think that having families involved in care impacts your practice? And they just gave us open-ended responses. So from that large survey, we wrote 2 manuscripts. One was looking at the numbers. So just that survey part of, did they answer 1 through 5 and what did those numbers mean? Then the second manuscript we wrote, which I'll show you here in a minute, was the qualitative piece. So this is where we took all of those open-ended responses and we did what's called a thematic analysis, and we looked at kind of what those words meant and how they grouped together into a general message or themes. So I put these up here just as an example for you to see that a study can have both quantitative and qualitative factors. So let's talk a little bit about qualitative. Qualitative is research that is concerned with the subjective meaning of an experience to an individual. I put up a graphic here with letters because I want you to think that quantitative is all about the numbers. Qualitative is all about the letters. So a lot of verbal or written feedback from research subjects. Now again, there's lots of different types of qualitative research. We have phenomenological, ethnographic, case studies, grounded theory studies, and historical. I won't go into great detail about each of these. I've just put the definitions on the screen for you. But I do want you to know that qualitative research is incredibly important to understanding phenomena in nursing. And there's lots of different, very scientific ways to go about getting this qualitative information from our subjects. And again, as I mentioned before, this was the same study, a different journal article, but looking at the qualitative data that we got from our survey. There's another category called translational data. So, translational research really transforms scientific findings or discoveries from basic laboratory to processes or applications at the bedside. So, we have a couple scholars at the College of Nursing who really are great at translational research. I can just give you one example of a study that I am currently working on that is considered translational. So, let me give you some background. ICU patients on a ventilator can't really communicate very effectively. So, when we want to look at things like how much anxiety are they having? Are they having mental distress? We can't really quantify any of that because they can't talk to us. So, how then can I treat a symptom if I don't know it's there? So, what we're looking at is using something called proteomics, which is the study of protein signatures at a cellular level, to see if there are certain protein signatures that a patient might possess that indicate they're having psychological distress. And so we're working with bench scientists who do all of this proteomics research. We're taking some blood from patients who are very distressed and those who aren't distressed, and we're running it through what's called a proteomics analysis. Now, the idea of this is eventually to be able to say, okay, we can't talk to this patient, but we can run their blood and see if they're having significant psychological distress. So see how we're taking the application of bench work in proteomics and trying to translate it to something that a nurse could use at the bedside to treat a symptom. Then we have mixed methods research. So this is a research approach whereby researchers collect and analyze both quantitative and qualitative data within the same study. Now, if you remember, when I was talking to you about quantitative and qualitative data, I mentioned that survey study. We collected both, but the difference is that we didn't merge the analysis and interpretation of the evidence. Mixed methods research requires a very purposeful mixing of methods in data collection, data analysis, and interpretation of the evidence. So I made you a little figure here. Mixed methods is not quantitative plus qualitative equals mixed methods. It's the merging of theoretical backings and of actual data collection methods and analysis to get results. To me, mixed methods research is very theoretically based and somewhat complicated to achieve, and something that I myself need expertise on. Mixed methods is something that lots of different minds have to come together to make sure that the data is in fact disseminated correctly. So I want to give you a quick overview of the research process. So despite what type of study you're doing, qualitative, quantitative, translational, mixed methods, you are going to need to follow a research process. So the first step of that process is conceptualizing an idea. So that idea might come from practice, something you saw as a clinical nurse. It might come from a conglomerate of things that you've read about in the literature. It could come from several different ideas that you've had before and putting them together. So there's lots and lots of creative ways in which nurse researchers go about conceptualizing an idea. But it is important to consider your research idea as it relates to the following, what we call FINER criteria. So FINER stands for feasible, interesting, novel, ethical, and relevant. You need your idea to be a feasible idea. I always say you can't come into a large academic medical center like Nebraska Medicine with lots of resources and lots of people and develop an intervention that's only going to work there. What happens if your intervention is at a very small critical access community hospital in the middle of Northwest Nebraska? We need to make sure that our ideas are feasible for everyone and every place. It needs to be interesting. Obviously, you don't want to bring something to study that's really not of interest to either the subjects you're studying or the hospital site, or really the literature. It needs to be novel. It needs to fill a gap that currently doesn't have enough information. So that comes, identifying that gap comes from being an expert in your field. We know what's out there, for example, in critical care world. I read a lot of different articles and a lot of different organizations, publications about critical care problems so that I can have a good understanding of what critical care nursing research needs. It obviously needs to be ethical, and we have mechanisms called institutional review boards to make sure that the ethics and what we are studying is appropriate. And then it needs to be relevant. It needs to be relevant to practice and also to the end users. If your research isn't relevant to those people who would benefit from it, then you shouldn't be conducting it. So I always say, when you get an idea, the first thing to do as a new learner in nursing research is develop what's called a PICO question. So PICO stands for Patient, Intervention, Comparison, and Outcome. So let me show you a few examples of what that means. You'll see my titles up here: Patient, Intervention, Comparison, and Outcome. And here's how you might design a question. So your patient is, in this case, let's just look at example one, is a patient with acute bronchitis. The intervention is antibiotics. In this case, there is no comparison. And the outcome we're looking at is whether or not we can reduce sputum production, cough, or days off. So that PICO question would read, in patients with acute bronchitis, do antibiotics reduce sputum production, cough, or days off? We can do this with every single type of research idea that we have. It's a great way to be able to break down your idea into very specific categories to ensure that you have something measurable.